what I've been hearing, New Year's resolutions, goals for 2025 for everyone listening is eat more colorful whole foods for your vagina.
Yes.
Love your vagina more. Touch it, feel it, play it around, look at it, work on hip mobility, and have stronger orgasms.
Welcome to the Physio Diaries podcast with your hosts, Dr. Melanie Ziaziris and
Dr. Alice Koshabatsky, where we talk about spicy healthcare topics, wellness, and life, all while traveling across the country.
All right, welcome to episode 15 of the Physio Diaries podcast. We have a super exciting guest on today, which is Dr. Janelle Howell, aka the Vagina Rehab Doctor on social media. And she's just a pelvic floor therapist guru. We'll talk about everything related to pelvic floor therapy, sex, taboo topics that most people don't talk about but should talk about more. But someone's got to do it. So we got Janelle here. So it's so great to have you on. Introduce yourself. Tell us more about yourself.
Absolutely. Thanks, you guys, for having me on the podcast. I'm excited to be here. So I am from Alabama. Grew up in a smaller city called Huntsville in northern Alabama. I went to Oakland University, which is a pretty small school system, Christian Black university, so historically Black college and university. So that's where I got my training in terms of undergrad. And then I actually went out to California to learn more about physical therapy. Yeah, so I went to the University of the Pacific. Out there in Stockton. I don't know if you guys have heard of Stockton, California.
I have.
Yeah. It's not much to do there, but it's close to the Bay Area. So I did my physical therapy schooling there, and then I actually did traveling physical therapy.
Yes,
for like
that's
2
awesome.
years. Yeah. I loved it. Absolutely loved it. I had no intention of stopping. And that's when no intention of stopping traveling physical therapy. Yeah. But then my recruiter, she told me about a position that was a travel assignment for pelvic floor physical therapy. And that's when I fell in love with it. So I took that position. It was only supposed to be 3 months, and then I extended it all the way to a year. And that's when I realized that I needed to stop traveling. So So yeah, I went to Chicago, did my women's health residency at Loyola. Then I took the women's certified specialty exam. Been working ever since, but now more recently started working full-time entrepreneurship. So currently,
and killing it.
Thank you. You're so sweet. Yeah. So I focus more so now on teletreatment via virtual coaching for sexual pain and vaginismus. So all things sexual wellness, that's really where we get down and we geek out. We just want women and all vagina CEOs to like have amazing sex lives and not feel shame, fear, or pain in the bedroom.
Yeah.
So that's
that is so cool. Yeah, when Mel told me that you were like all virtual, I was like, that is amazing. And I can't wait to hear how you do all of that. As a pelvic floor therapist, and you can reach so many people that way, which is amazing. So
absolutely,
that's awesome.
It's great. I love it in the sense that it just expands your horizon in terms of the amount of people. I do think that there's a great value and experience that comes with seeing someone in person. Like you can't really replace that. But with teletreatment, it just expands the options and the access. So there are parts of the world where there's just not a pelvic floor physical therapist in the city that someone lives. Or maybe they've tried them, but it just didn't work out. There's not enough options or diversity. Then you have people who have already tried the in-person route and it actually didn't work well. So we specialize in this one problem of like, does sex hurt? Do you have enough pelvic floor mobility to even have penetration? So that's where we specialize. And I think because we tend to focus on just one issue, one problem, and one type of person, essentially, that allows us to sort of own in on our skill and people get better even though it's virtual. So, and usually actually quicker than in person. So yeah, that's Vagina Rehab Doctor. And I can't wait to get into more of the discussion.
So this is actually going to be really interesting because obviously Janelle here, pelvic floor therapist expert. This is what she does. I do orthopedic neurological conditions and pelvic floor. So I kind of do a little bit of everything, but obviously not as much of an expert as Janelle. And then Alice
You're
here
still
does
an expert. Yeah, you're still. I had to put that in there. You're still an expert, and I actually love the fact that you're studying the neurological because the nervous system plays such a big part in pelvic floor dysfunction. And so like learning more about the nervous system and how to treat that and how our nerves, our brain interacts with our muscular system is huge. And I do think that we just, as a whole, as pelvic floor physical therapists, could understand and sort of get more training on that part of our system, our mind, our brain, our nervous system, actual nerves. So yeah, you're an expert. We're all experts.
That's fair. I appreciate that.
Addicted to like what? Yeah, I feel like I'm just like addicted to one problem, like almost consuming it as much as I can. But I think it's important to have understanding of different areas of the body. You know?
Yeah, definitely, totally. Yeah. Well, so kind of diving into some of the questions we have for you. First of all, pelvic floor PT has been gaining a lot more attention and credit. I think it has a lot to do with social media. But there's still a lot of people out there, including a lot of my family members, that don't know what pelvic floor therapy is. And so as a pelvic floor specialist, can you just kind of give us like a brief overview of what exactly pelvic physical therapy is?
Absolutely. So pelvic floor physical therapy is, I actually hate when people say they're going to pelvic floor physical therapy. And the reason why I hate it is because it is the only industry in the medical field where you say that you're going to the actual type of care instead of the professional. So when you're going to get your teeth worked on, you don't say, I'm going to dentistry. You just say, I'm going to see my dentist. Right? Or if you're going to the doctor, you say, I'm going to see my doctor. You don't say, I'm going to medicine. Right? But for physical therapy, I don't know why where this comes from. I know we're not necessarily doing it, but there's something in the history of how it was founded that people say they're going to physical therapy. So I say that we as physical therapists, pelvic floor physical therapists, are pelvic health providers who focus in on the neuromuscular function of the pelvis, enabling women, men, all genders to have good control of pee, poop, pleasure, and pregnancy and postpartum. All the P's.
All the P's.
All the P's.
And so if you're having issues with one of those, any one of those, your pelvic floor could be involved. And I would go as far as to say it probably is involved.
Yeah.
So, yeah. That's what I would say. Yeah.
And I would also like to say, just throw in for women, a lot of low back pain overlaps.
Absolutely. Oh, so maybe we could say, so pleasure, pee, poop, pregnancy, postpartum. The word is the core, but that doesn't start with a P, so it's throwing me off a little bit.
I know, I'm trying to get the P word.
Something maybe like posture or pelvic. I don't know. We'll figure that out, but
we'll think about it. It'll come to us.
Yeah. Just overall core stability. I think the pelvic floor doesn't get enough. Like we know when we hear the word core, I think most people are just thinking about the abs. And
totally.
Right.
Yes. And there's actually, that's a really good point that you said that, because I've actually seen a lot of people trying to like get out of saying the word core training because of that. So I try to use a lot of like trunk stability or proximal stability, and kind of switch up the verbiage, because most people think it's just abs, but like we have the four walls, right? So we do have abdominals, we do have spine multifidi or back muscles, pelvic floor on the bottom, diaphragm on the top. So we gotta do all the walls, right?
Exactly. And I think that the bottom and the top is like just frequently left out, or if someone doesn't have symptoms for the pelvic floor, then we can think that the pelvic floor is fine, which is, you guys know that that's not always the case. And so,
Right.
yeah, like someone can be like completely symptom free and like, how are you having sex pain free, child? Your pelvic floor is sometimes I'm like, my finger can't breathe. I'm trying to examine your pelvic floor. My finger is getting strangled by your tension, but they're not having pain with sex. I'm like, how is this possible? So
Yeah, fair. Good point.
Yeah.
has it happened to you before?
I'm trying to think. Honestly, yeah, in certain areas for sure.
Yeah.
But yeah,
Like,
I
how
guess
are
I
you
guess
not
a little
in
bit.
pain?
Yeah. Most of the time I'm like, okay, I know you have painful sex.
Right.
Or like maybe at that point they're so used to it that feels like that's their normal, so they don't think
Fair.
it's painful and they think it's
Mm,
normal.
that's a
and
good
and you're like,
point.
wait, no, this is not normal.
Yeah.
That's what I'm
Yep.
guessing is a non-pelvic floor PT bit.
No, good point.
Absolutely.
Yeah.
And I think that's really common just for being a woman, unfortunately.
Right.
Right.
So many. I mean, thankfully, I feel like we're waking up slowly as to what's not normal. But I mean, even when we were like in middle school, I mean, we were told that periods are supposed to be painful. That's normal. That sex on your first few times, it would just be painful.
Yeah.
Like
Really?
we've been told that a lot of things are normal, and it's or having a baby and just peeing your pants afterwards.
Oh my gosh.
Like,
Yeah.
no, it's not normal. So I think we as a gender have been, unfortunately lied to quite a bit. And it's going to take a lot of advocacy because, again, most people don't even hear about pelvic floor physical therapists. So the empowerment that we're getting around women's health in general, I think is so key. But like you all said, especially you, Alice, I do think social media is playing a big part with spreading the awareness because most people can access Instagram or TikTok. And so more people are able to start hearing about the pelvic floor, which is good.
Yeah. I'm always trying to spread the word out to you guys. Like anytime I have a patient that mentions anything that I think a pelvic floor PT could work with, I'm like, I educate them. I'm like, there are therapists, there are PTs that work with this kind of thing, and you do not have to deal with this because we are exercising our patients and they'll be like, yeah, I can't jump because I always pee a little. I'm like, that's not normal.
Yeah.
Like, they're like, it happened since my last pregnancy. And I'm like, you can fix that. Like, there's therapists that work with that. So
it doesn't have to be your normal.
Exactly. And I'm always trying to spread the word.
Yeah.
And honestly, for sure. I'm curious. Sorry, were you going to say something, Melanie?
Oh, no, you're good. Go for it.
I'm curious as to, well, I know we're patriarchy. As much as that's so cliche to say, but in my head, I'm like, certain terms are known for male conditions. Like almost everyone has heard of erectile dysfunction.
Oh, yeah.
But how come everyone hasn't heard of vaginismus?
Yeah.
Right. So it's like,
or,
that's a very
not being able to orgasm.
Not being able to orgasm. And I feel like the name for that, I feel, is not known, but I do think people know that they can't orgasm, but they don't know that it's a thing, like an actual medical condition. But yeah,
we'll talk about it.
There's a lot of partiality in pelvic health.
Yeah.
Just with sexual wellness, because most people have never heard of certain things, vulvodynia, vaginismus. But if you say he can't get hard or erectile dysfunction, everybody knows what that is.
Yep.
Right.
You know? So there's a lot of work to be done.
It's a huge industry for them, like.
Exactly.
Yeah, of course.
Yeah.
Exactly.
But okay, I'm going to jump around a little bit because we're already talking more about pelvic floor therapy and sex and stuff. So I just want to keep that flow going. Okay. What are 5 tips for women with vaginas that you would say best keep their precious gem in tip-top shape and happy?
Oh, that's a good one. Number 1, look down there and check in there. Okay.
Yeah, look at it.
No, look at it and actually go in there and check it. So this is what I would say is like we have, as women and vagina CEOs, collectively, we have more fear and disassociation with our genitals. If we touch down there, if we're comfortable down there, there's going to be a higher chance that we're going to be shamed because of it. Men, they don't really have a choice. They have to touch themselves to pee. And also, they're just touching themselves more. And we're all, they can be relaxing with their hand in their drawers. Like, they're just chilling like this. So they're very comfortable as a gender with their body. And I think that contributes to their higher rates of sexual wellness. Now, I'm not saying that's the only thing. Again, there's a lot of gender biases. There's a lot of lack of research in medical care for women, especially for sexual medicine. But I think it starts with we have to take ownership of our bodies. Like, that's your vagina. You should, at some point, look down there, get a clean finger, clip those nails down, insert a finger and just see, like, does it feel tense? Does it feel painful? Does it feel squishy? What do you feel? And I think that's number one. So I think we have to address the discomfort, the fear, the phobia, really, that a lot of women have with their vaginas.
Totally. Actually, off of that, one of my friend groups in college, we were just like, I don't know, talking about just like vaginas, masturbation, whatever. And there was, I think, 4 of us. And one of the girls in the group was like, no, like I've never masturbated or looked at it. Like it just feels weird.
Looked
like,
at it.
Yeah. And me and the other girls were like, are you kidding me? Like, what? How? Why? How? Like, didn't really realize that there was that much like shame around it until I guess hearing from more people that like really don't do it. I'm like, wow. I feel like I started at a very early age, just like super curious, just like looking, exploring. I'm sure that's like one reason why I'm so comfortable with it now. And like, I'm a pelvic floor therapist, but it's really interesting to see that difference.
Absolutely. And, you know, with us focusing on sexual pain and vaginismus, 80% of the time there is some anxiety, there's some phobia, or there's some fear surrounding either fear of pain, fear of vaginal insertion, or just fear of their own vagina, right? So we see it a lot, and I think a lot of the bigger contributing factors to it are culture, religion, and also just upbringing, what you were told about sex. So if all they were told is that it's going to be super painful your first time, or all you remember about your vagina is if you leave a tampon in too long, you're going to get toxic shock syndrome. Like that, I mean, we're laughing, but it literally creates issues where people cannot have sex with their spouses. They can't get pregnant. They can't have a pelvic exam. And so I think it really starts also, I would say number 2 then is healthy conversation around sex. Like we need to be embracing sex as something that's good, something that when it's normal is pain-free and pleasurable, and a great way to foster closeness and intimacy in a relationship. Like it's very vital. We would not be here without sex.
100%.
Like let's just honor. I think there's a lack of respect. I feel that a lot of people look at sex as like dirty. Even the way we describe it is like freaky. You're being nasty. Let's get dirty. Like all the ways we describe sex is bad. And I
like
think
bad connotations with it.
Yes. I think we need to change. Not that it can't be those things, because I'm going to say those things too.
Right.
Like I'm going to get freaky and dirty. But I do think that we need to embrace more positive language around sex. That's number 2. Because it starts with what you're saying and what you're thinking about your body. Like we can't overemphasize that. Number 3, I would say, is your hips. I really
good
know,
one.
I have personally experienced it. If your hips are tight, if your hips are painful, if your hips are weak. So hip flexors, your butt, the size of your hips. So just working on that is going to naturally help your pelvic floor because of the close nature between the hip and the pelvic floor. Like they're literally right there. They're sisters.
Right.
Yeah.
So I think sometimes we zoom in too much sometimes. And sometimes we need to zoom out and look at the bigger picture of our health. If your back is always hurting, like that's probably, like you just said earlier, Melanie, that's impacting the pelvic floor. And so I think hips, like if you want to bust it wide open in the bedroom, you should be able to bust these hips open. And that's contributing, and not just to sex, even to incontinence, right? So people who have weak glutes and tight hips, higher chance of prolapse and incontinence. And so I think that's something that's really important, especially with a generation like us who does so much sitting. Like we sit a ton. And so we have to spend that time moving our hips and opening our body. And I just feel very guilty saying all of this because I'm preaching to myself in this moment. So yeah, I need to do the things that I'm saying, but I have definitely seen what happens when we address the hips. And so that's number 3, I would say.
Okay.
Number 4, I would say, is education. Like, there's so many people that have sent me messages on Instagram of like, I had my first orgasm.
Bombarded.
Yeah, like I've had my first orgasm coming to your master class, or
yes,
just
love
doing,
to hear
just
it.
doing,
That's
just
awesome.
doing the stretches. Sometimes it's not even paid things, like just doing the stretches on your Instagram, and you telling me not to keep going to the bathroom for no reason.
Even hearing about it.
Yes.
Yeah.
So I think we have to be willing to invest in our health, like put money down and also put time down to learn about your body on a deeper level than, what's just said on Google or TikTok and stuff like that. So education is, I think it's so unmatched. Number 5. Wow, you guys really put me on the spot here.
Last one, best one.
I would say number 5 is food. I do think
yes.
I know you'll love that one, Melanie. You're so into nutrition, and Alice, you probably are too. You have that clear skin, so I know you're eating the good food. But I think there's so many foods that can really help with vaginal health. Like, for example, protein. A lot of women don't get enough protein in their diet, and the vaginal wall is literally made of collagen and protein. And so if
back to collagen, just gonna say it.
Yeah.
I just had a whole rant about collagen on the podcast.
Did you? Yeah. And
we've talked about it a little bit, quite a bit.
Yeah. Did you really?
Yeah.
Oh, wow. I need to go back and listen to the collagen episode. But yeah, so that's just an example. You don't have to be a bodybuilder to prioritize protein. Like, do you want a healthy vagina? Like, so I think that's something that we need to prioritize more. Just especially as a Black woman in our community, we struggle a lot with like anemia, fibroids, heavy bleeding. So iron is typically low. And I think just from the chore, like it feels like a duty to be popping a pill and stuff, but it's kind of important for your cells to have oxygen. So low iron is one of the top causes of vaginal dryness. And most people don't know that. So
I didn't know that.
Get your iron, girlies. Your vagina can't breathe, right? If your vagina is suffocating, you are not going to get wet. So nutrition, I think we could just talk more about food and why we're eating certain foods. I do think that can motivate us more if we know what it's going to do for our body. So that's number 5.
That's actually crazy, Mel, because we were just talking about this earlier, how like in chiropractic school, they do get a whole bunch of nutrition classes. And I feel like that's something that PT schools, I wish, like we got no nutrition whatsoever. And that goes hand in hand with our jobs. And I just think we should have at least a little bit more of a background on it.
In general, like all like medical healthcare fields, like diet directly influences inflammation in the body too. So like we should all be talking about it more.
Yeah, and anti-inflammatory. I'm glad you brought that up. Like just eating, I just try and eat like not all the time. I'm not a Melanie. Okay.
It's okay. I don't eat the best all the time. 80-20.
On a whole nother level.
Yeah.
She's no, you're on a 95.5, okay? So I try and get the antioxidants that are brightly colored. So like things like turmeric.
5 colors a day.
Beets, right? Things that really stain stuff. Those are some of the strongest antioxidant blueberries. Like, these are so good for us. And so I really want to build stronger habits with food because I see what happens when I don't eat good. So I know what happens when I don't eat good, how it impacts my hormones, my weight, everything. What would happen if I just did the opposite and like really nurture my body with like the medicine of food? So I definitely believe in that. Yeah.
Yes, I love that. Those are really good tips. I love all that.
Yeah. Well, thanks.
We had a fun question. I'm curious about this too.
Okay.
Is the G-spot a real thing, or is it more of like a region, or is it specifically like one little spot? What do you think?
So the G-spot doesn't exist. The G-spot doesn't exist.
Okay.
But it is a place. But it's not like a separate entity that's just creating pleasure all on its own. It's just a part of the clitoris. The internal part of the clitoris is creating that sensation. And the CUV, the clitoral urethral vaginal complex, is called the CUV, is where the clitoris meets the urethra and where the urethra meets the vagina. And so that's where the G-spot is. So I'll show you on this one. So if we go into the vagina.
She's got a model.
Yeah, maybe about 1.5 inches into the vagina. Our thumb, our finger, or whatever needs to be facing upwards. And then if we press upward, we're pressing on the clitoris.
Yeah.
So that's not like some spot. You're just touching your, like, put some respect on the clitoris.
True.
The G spot was named after some man. His name started with a G. I don't remember, but it's not like a random spot. It's the internal part of the clitoris. And so that's actually helpful to know because if you're really aroused, if you're already aroused, horny, wet, and you get something, whether it's your finger, a dildo, an internal toy, and stimulate that part of the vaginal canal, you can orgasm. And I get this question a lot from women on Instagram. I can't orgasm from penetration. I can't orgasm from penetration. And we're not really supposed to. If the clitoris is not getting stimulated, you're probably not going to orgasm 80% of the time. So 80% of women and vagina CEOs, we're just not going to orgasm for something just going in and out of the vagina unless you're intentionally stimulating a certain part of the clitoris, right? So research has also shown, though, that some people have a shorter distance from the clitoris to the urethra. And it's called I think it's called the clitoral urethral distance. So the shorter that distance is, the more likely someone is to orgasm from penetration pretty easily. But it's just very rare, right? So the closest your clitoris is to the vagina and the urethra, then of course you might orgasm. But 80% of us or more, we just need that direct clitoral stimulation, whether it's internal or on the clitoral head, which is what we call the beam, right? Is that what we're calling it?
Yeah. The female tip or vagina tip, vagina CEO tip. That's such a good point though, because, and I feel like I don't have these conversations like a ton, but like it's definitely a thing where like women don't realize how much the clitoris is involved with like penetration and orgasms, right? Like, so many women just don't orgasm because they don't really know like how or what is exactly is involved because like we don't talk about the clitoris enough. And like I know I personally, and I know other people, like you can only if you orgasm for penetration, like it's a very specific and certain position. Not all positions are going to do it because you're not getting that area.
Right. The clitoris is I think so important for a lot of stuff. When your clitoris is stimulated, dopamine is released. When your clitoris is stimulated, it helps us to get a clitoral erection, which actually leads to lubrication. The clitoris lifts the uterus up so that deep penetration doesn't hurt. I mean, the clitoris is, listen, I only worship God, but if I didn't believe in only worshiping God, I worship the clitoris.
Hail the clitoris.
Hail the clitoris. clitoris come through. I mean, the clitoris
It's a
just does so
wonderful
much.
thing.
Yeah. And
Yeah.
it's just, it's even helpful for giving birth. A lot of people are doing that now. They're doing orgasmic birth.
Okay,
where
yes. I've heard
they're
that.
stimulating the clitoris, having orgasm, because that helps secrete more oxytocin, which helps with the contraction of the uterus, right? And it also helps with having an orgasm. So just don't ever think that you're taking too long or you're asking for too much. Or I understand sometimes you want a quickie. It's like, hey, just give me the pink. That's fine, you know? I think there's a time for that. But like generally speaking, we need the clitoris to get its attention, and that takes time, you know?
Yeah. Since we are on the topic of orgasms, you help people with vaginas orgasm, get orgasms, have stronger ones. And a lot of people don't realize that has to do with, right, like strength, weakness of the pelvic floor, mobility of the pelvic floor, like the actual like structural kind of component of the pelvic floor. So tell us more about that. Like, what advice would you have for women who haven't ever achieved an orgasm or have like really weak ones and like, you know, really want to get a good quality orgasm in?
Yeah. So, hey, I would say, first of all, respect the goal. I think that we don't prioritize pleasure goals enough, especially in this society that's very capitalistic. We're going to prioritize career and houses and degrees and also marriage. When someone gets married, man, people really just show up. But aside from that marriage, most of the other things that we really prioritize are not pleasure based. They're not leisure based. They're not rest centered. And so I think first it starts with understanding that it's important. Like if you're not orgasming, I think you are doing a good thing by figuring out why. So number one is just respect that role that pleasure plays in your life. The next thing I would say is like, if you're having other pelvic floor issues, difficulty controlling your bladder, difficulty starting your urine straight, tailbone pain, you have to clench really hard. And this is common. A lot of people are like, have to squeeze really hard to reach that orgasm. And we see that commonly with people who have pelvic floor dysfunction, because the pelvic floor should be doing this. It should be contracting, relaxing, right? Contracting, relaxing. So closing and opening. But if it's already closed because it's too tight, then you're going to need recruitment from external muscles to help support muscular engagement in the pelvic floor. So that's what we're seeing a lot with people who have pelvic floor dysfunction. So pay attention to your pelvic floor symptoms that could be directly causing the orgasm issues. We also do have to pay attention to medications. So sometimes it's not pelvic floor related. Like antidepressants are sort of notorious for disturbing libido and someone's ability to orgasm. Also, if estrogen levels are low in the vagina, the clitoral region, then that's going to impact the tissue health of the genitals and the blood flow. Blood flow is really what helps us to get there, in addition to some other things. But if there's not enough testosterone and estrogen, there's not going to be a sufficient clitoral erection, which helps us to orgasm. So the pelvic floor and the clitoris have this interdependent relationship. So when your clitoris is stimulated, so when your clitoris is stimulated, there's a nerve that goes to the pelvic floor that tells it to naturally contract. And then when that happens, when that contraction happens, it's pushing blood back to the clitoris. So the clitoris is touched or stimulated in some way. Pelvic floor contracts to push blood up. And then the clitoris extends even more, it gets bigger, and it just does the same thing. So that means that your pelvic floor needs to be healthy in order to have this back and forth relationship with the clitoris to help us reach the fireworks, the orgasm, the climax. So I like to say, if you feel like you're a tense person, if you feel like you're an uptight person, your vagina is uptight too. Like usually
directly related.
Yeah. And so starting off with just like slowing down, meditation, relaxation, breathing, stretching, that's going to be key. if you notice that your pelvic floor feels a little bit more weak or lax, which is a medical term for loose, like let's say you put a tampon in and it feels like it's constantly falling out, but there's no pain with inserting it. There's no issue with getting it in, but it always feels like it's falling out. Or a lot of queefing, so like vaginal farting. That's happening a lot, even outside of sex, because I think it's pretty common for that to happen, like during sex, especially doggy style.
Totally.
Then, those are some signs that you want to look into working with the pelvic floor therapist if you're able to access one, because you can start coming, you can start orgasming. So I went on a tangent there, sort of.
No, you're good. That was great.
But that's what I really think more people should look into.
For sure. I always tell people to orgasming is just your pelvic floor's muscle contraction. Just like any other muscle.
Exactly.
Yeah.
And that keeps it, I think that makes it simple and helps people to understand that if I'm not orgasming, that means my pelvic floor is not contracting well or relaxing well. So that simplicity in how we explain stuff, I think, is very key, because we don't want to confuse people, which they don't do anything if they're confused. So
fair. They're it's kind of overhead. Yeah.
Confusion. Like when you go into a store and there's too many options, it's I'm out.
Overwhelmed.
Exactly.
Right. Yeah, exactly. Yeah.
This is great. I feel like I'm honestly learning so much, and I'm gonna take some of this knowledge and distribute it to my patients.
You're not getting off easy. I'm trying to learn from you, because I haven't done ortho specifically in so long, and I do think that ortho has a big part to play in pelvic floor. Even when I just post exercises on Instagram of stuff to do for incontinence or sexual pain or tailbone pain, there's a lot of people saying their knees. They're like, my knees, I can't do that exercise. My knees, I can't do that stretch because I can't get on my knees. I mean, so the lack of orthopedic help is now standing in the way of accessing exercises and things that would be good for the pelvic floor. So it's very interrelated and so important. And I'm glad that y'all have this podcast combining pelvic floor and ortho. Yeah, because I think we need to keep it holistic. And part of it is having professionals from different sectors. So I think that's really cool that you guys have sort of collabed in this way.
Combine the both worlds together.
Yeah.
I was also going to say, that reminded me, I actually have a patient right now that completed pelvic floor therapy and only found out that she was having hip dysfunction and hip issues during pelvic PT. So they had her doing a happy baby stretch, and then she realized she was having this hip pain, and the pelvic floor therapist was like, okay, a lot of this is also coming from your hip. So she completed her pelvic PT and is doing a lot better, but she still needs to address the hip pain. So I got her right after. So it would be awesome if I could do both. So that's kind of the goal eventually.
Was the pelvic floor therapist Melanie?
No.
Listen, because I was going to say, why did the pelvic floor therapist
direct referrals?
No,
we are literally across the country from each other.
Oh, really? Okay.
Yeah.
Oh, yeah.
So I'm in Wisconsin right now for a travel contract. Yeah.
Wow. Okay. And you're in Texas, right?
No, I'm in Florida.
Oh my gosh, I can't keep up with you.
Yeah. I know. I'm everywhere.
Florida. No, but what I was gonna say is the hip, to me, that's still pelvic. So if someone's coming in for pelvic floor dysfunction and you're finding hip issues, I do believe that we as pelvic floor PTs should be able to treat that hip. But that's just my opinion.
Yeah, I think they had said something about insurance approval. So they were like, okay, that's it for your pelvic. So then she had to go in for a separate condition. I think that's what it was.
Yeah.
That is
ridiculous.
Interesting.
I shouldn't know.
Yeah. I know.
That's so funny. You say that though, because I've actually seen, I'm probably not allowed to do this actually, but if people come to me with certain things, I'll just add codes on, treatment codes, and just add it all in, even if they're not technically the referral. So that's funny. And I feel like a lot of people are kind of more strict about it.
Yeah,
but I don't know if I'm supposed to do that or not.
I think that's fine as long as like you're in a direct access state, because you can see a patient for like a different condition.
Oh, that's a fair point.
But yeah,
Insurance,
I guess
man.
it depends on insurance. I was gonna say if insurance covers it, then
You don't got to deal with that no more.
yeah.
You see, I'm quiet. I'm just like, as I don't remember all the codes and stuff, but yeah, we don't do that.
Yeah.
Yeah.
I did have a question. Okay, this actually, when we were talking about ortho stuff earlier, I just unlocked a memory. But me and Janelle went out to get Thai food one day. And actually, that's when I learned that she was a travel therapist. And that was how I was like, she did AMN health, so I'll probably do it because she's had good experiences. And I didn't know about internal travel PT yet. But we were at her house just chilling, and she wanted to learn how to like touch her toes. And she was like so out of the loop with
the most flexible person ever. She is so flexible. And I'm like, I had to stretch like 5 times just to like comfortably touch my toes.
Yeah.
And for the stiff people listening, y'all know we're family. We get it. Like you can do it if you just sort of bounce down there. Like, yeah, I can touch my toes, bounce like
For a second. Yeah.
yeah. But like, yeah, I really wanted to. You got to come back to still help me.
Yeah, that's fair. I was trying to show her like anterior tilt and all that to lengthen those hamstrings a little more.
Wait, I have a question.
Oh,
How did you guys?
They're horrible now. I'm
I was gonna
honest.
say, can we talk about how you guys met, or like how you guys got in contact with each other?
What do you remember, Janelle? Because I know this story. I just want to know your viewpoint.
Okay.
Like, what do you mean? I've known you forever.
I think, Melanie, you were following me on Instagram.
Yes.
Yeah, you were following me on Instagram. I believe I was leaving work one day from Northwestern, and I don't know how we started talking. I just know I left work. I was working downtown at Northwestern here in Chicago, and I think she was going to school at Northwestern, but I can't remember.
We both went to Northwestern together.
Mm-hmm. We both went to Northwestern together?
Like me and Alice.
Me and Mal, yeah.
Oh, I'm like, Okay, yeah. So, yeah, you tell the story because my memory is,
No, yeah, that was pretty much it. So, yeah, I was following Janelle. I just, like, found her on Instagram, and I think I was going to clinical, actually, because we went to Northwestern, and then my clinical was at Northwestern. One of my clinicals was at Northwestern, and I was, I think, walking to clinical, and you, or maybe walking back from lunch break, and I think you were on your lunch break or something, and literally, I like see her walking towards me on the sidewalk on the side of like Superior or whatever in Chicago. And I'm like, no fucking way. That's Janelle. That's her.
Wait, that's so funny.
So I went up to her and I don't even remember what I said. And I was like, gosh, like I've been following you. I love your content and whatnot. And then we just like connected.
Yeah, I remember that. It was, I think it was like a cool day, not a hot day, like a cool, chilly day. Yeah, I remember.
Yeah, I think I was wearing a jacket.
Yep.
Wait, that's so funny. What are the odds of you just like literally crossing paths?
Yeah, and I don't even think I knew you worked at Northwestern at that point. I was like, wait, she's like in downtown Chicago? Like what?
Yeah, because when you work somewhere for a facility, especially a big facility like Northwestern, if you're posting online a lot, and if you're not posting on behalf of that institution, you do need to like sort of switch your name tag, because you don't want that institution to say, hey, that's not a video that we endorse, or that's not representing us as an institution. So I think whenever I made content, I wasn't like actually showing where I worked. I would like try and cover the logo, or I would just do whatever. So yeah, that was cool. And I think that was 6 years ago or something? No, not that long. Right?
No, maybe 3 or 4. Well, because I think it was second year of PT school. Yeah, because it was my acute care clinical. So second year of PT school, maybe like 4 years ago.
Yeah, 3-4 years.
I think 4. Yeah. Wow, time is flying. Yeah,
okay. I know. Crazy.
And look at you now with the whole podcast and traveling.
You too.
All the travel.
Janelle also has a podcast, you guys. and it's all about what we're talking about today. So that is definitely one you should check out.
Every Monday, new episode.
And then go listen to us every Tuesday. So you got Monday Janelle, Tuesday us. There you go.
I love that. Are y'all once a week, or how often does it drop?
Yeah, once a week.
Okay. Yeah. Okay. So let me make sure I got the name right. The Physio Diaries. The Physio Diaries podcast on Tuesday. The Vagina Rehab Doctor podcast on Monday.
Perfect.
We got it. Okay.
What a great start to the week, honestly.
I know. Yeah, exactly. So educational. So,
yeah.
Well, I want to ask one last quick question. For anyone that's kind of looking to go into like virtual therapy, what advice would you give to both like patients and then also on the clinician aspect of it?
Oh, that's a really good question. For virtual, I would just say do it. I mean, for the therapist, I would say do it. I don't have any regrets. Why am I talking like this? Regrets. I don't have any regrets, but I think that there is a little bit more convincing taking place with virtual treatment and virtual care, just because telemedicine is new. I mean, before the pandemic, most people are not going through a computer for a doctor's visit. You know, I think it's great with more data, more access to, you know, technology. There should be medicine intermingling with the different ways that we're able to advance with technology. However, because we've been going in person to medical appointments for longer, I do think that there's a little bit less trust. So I do think that if you're interested in going to virtual care, it's great. I do think I don't want to go back to in-person. However, just be prepared to really be able to communicate the value and how you're going to be able to help people, and also the confidence that you can, because people are looking for that, especially if they're going to work with you virtually. They're really looking for that confidence that you can help them. So that's what I would say. Then to the patients, I would say, give it a try, because if what you're currently doing isn't working, then teletreatment can be the thing. I will say that it's a higher emphasis on self-care and action. Whereas in person, I do feel like you have a little bit more wiggle room to just sort of not even do anything at home, because you're depending on your provider to use a lot of great skills that we have to make change. And so a lot of times our patients really do depend on us. They're waiting for that next session. You know, that's not a thing with teletreatment. So we're giving you a lot of guidance, but it also depends on you partnering with us by following through and taking what we have to say into account to really show you the results that you're looking for.
Right. Like you're providing your patient with as much as you can, giving them the ammunition, and then it's on them to really use it and do what you tell them to do.
Yes. I think one way in which we're different is we do a lot of what we instruct them to do, or homework that we have them do it in the session. So that helps.
Yeah.
That helps for us, because we're able to now, you know, help them strategize a little bit more, understand their pain more, understand, you know, why this side is hurting, why this side is not. So it's very hands-on, and I think that approach is helpful. But again, a lot of people don't understand that before, and so it can be a little bit of a challenge communicating how we're able to help people through a digital platform. Yeah.
I was going to say another thing that I see as a benefit with virtual, like pelvic rehab, is the fact that, like, I know at least a lot of my friends too, that I've told, like, hey, like, you would really benefit from like seeing a pelvic floor therapist. They'll be like, well, I don't know if I'm comfortable with that. And I think maybe like them being virtual might help them like open up a little bit more and just be a little bit more comfortable too. Cause like some people, it's just easier that way too.
I agree. I totally agree, because I say this sort of jokingly sometimes. I'm like, listen, I know it's virtual, but your camera can be off. We're not digging in your vagina. You get to, you get to reserve a big part of your privacy. And especially if there's a history of like sexual trauma and stuff. People are avoiding pelvic floor therapy for decades. They're just not comfortable. So I do think it's an avenue to reach a certain type of person that's just probably not going to do the in-person, and even the access in terms of time availability with kids and all of that. Sometimes leaving to drive to an appointment is just not it. So I full-heartedly, of course, I'm biased and believe in virtual. And I think that, you know, we should try and get more research to support it and show the efficacy. So I'm not going to do the research myself, but I'm open to reading it when it comes out.
Fair. Valid. Yeah.
Yeah.
Okay. Before we wrap up, what I've been hearing, New Year's resolutions, goals for 2025 for everyone listening is eat more colorful whole foods for your vagina.
Yeah.
Love your vagina more. Touch it, feel it, play it around, look at it, work on hip mobility, and have stronger orgasms.
Oh, yes.
Those are all amazing.
Yeah. I love it. I'm claiming it for all of us, too. Melanie, Alice, and Janelle, we're claiming those better orgasms, the colorful food, and all of that. So, yeah. Thanks for having me, you guys, on the show. I really appreciate it. Yeah, absolutely.
Yes.
We really appreciate your time because we know you're, you know, busy with all the things that you're doing, and we really appreciate you coming on here.
Oh, yeah. And shout out to Melanie for her patience in getting this schedule. She is one persistent cookie. She did not give up.
She does not let down.
My gosh. I was like, okay, I'm going to have to do this because she's gonna find me.
She's gonna find you.
Yes, if I would have said no, she would have been right there in 2025. Janelle, come on the podcast.
Just like she found you at Northwestern, she will find you everywhere else.
Right.
She planned that out that day.
I love that. It's the tenacity that I love. So yeah thank you. Both of you. Thanks for having me, and I can't wait to listen to the episode.
Thank you. Janelle, we want to thank you again for joining us today and sharing all of your amazing expertise with us and all of our lovely listeners. Where can everyone find you and all of the great resources that you have if they want more information?
Yes, please come find me the same way Melanie found me, and she always finds me. My website is www.vaginarehabdoctor. So everything is spelled out. There's no abbreviations. VaginaRehabDoctor.com, www.VaginaRehabDoctor.com, and then Instagram. That's where I am most commonly in terms of social media. So the Instagram handle there is the same, Vagina Rehab Doctor, everything spelled out.
Awesome. Making it easy on everybody.
Yeah.
Okay.
Oh, yeah.
Yeah, we will also link all of Janelle's social media and her website and everything below in the description of this episode. Make sure you are also following us at the Physio Diaries podcast to hear all about the exciting things that we have planned for the rest of this year and the coming year. And don't forget to rate us because that really helps us out. And that is all.
Absolutely.
And Janelle's podcast too.
Yeah.
Oh, yeah. Oh, my gosh. Should I mention that now?
Is your podcast the same? Yeah, you can mention it.
Yeah. So the name of my podcast is the Vagina Rehab Doctor Podcast. And it's not vagina. So everything else is just Vagina Rehab Doctor. And then podcast is the Vagina Rehab Doctor Podcast.
Yeah,
so
we get
I'm on all platforms and then every Monday. Yeah.
Yes.
All right. Awesome.
Amazing.
So tune in on Mondays and Tuesdays every week.
Every week.
Bye.
Bye.
Bye.